Hi, I'm Linda, creator of information about arthritis. If you are new to this channel, then don't forget to subscribe. Just click the subscribe button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, Food with Arthritis, where you can find out more about these terrible diseases and download free articles. Osteoarthritis, osteoporosis and osteopenia are all related as they attack the joints in your body. The only difference is that osteoarthritis is wear and tear of the cartilage that covers the joints and stops the bones from rubbing together. Osteoporosis and osteopenia reduce the density of the bones. Osteoporosis causes your bones to break easily, also causing brittle bones. Some medications help treat this disease and may decrease how speed the bone is breaking down. And there are some that help to increase the rate of the building back up of the bone. The way they determine how your bones are, the doctor will examine the T-score of your bone mass. You can prevent your child from developing osteoporosis by helping them in the early years. You can do this by helping them eat and drink healthy that are rich in calcium, such as milk, dairy products, yogurts, cheese and eggs. Also, give your child vegetables like collard greens, kale or broccoli, spinach or kelp and soybeans or white beans. They need to eat fish as well, like sardines and rainbow trout. Vitamin D is also helpful with getting healthy bones. You get this from going out in the sunlight. You are at risk of vitamin D deficiency if you stay indoors or if you are dark-skinned. Eating a healthy meal, such as 5 a day of fruit and vegetables. Always go for low-fat, high-calcium foods, such as sweet potato and green leafy vegetables. Or fruit such as bananas, apricots and prunes. Any type of berries etc. You should limit salt and sugar. This means that you cannot have any sugary cakes or drinks. Also, it would be best if you avoided carbonated beverages such as fizzy drinks. The best is to drink 8 glasses of plain water per day. And if you smoke, you should stop. Also, it would help if you drank less alcohol. You can prevent the disease from developing more and slowing down by doing some exercises. There are 2 groups of exercises: high impact and low impact weight bearing exercises. They should be done every day for half an hour, but when you have brittle bones, you should not do high impact exercises involving jumping, dancing, aerobics, and many more. It would help if you did low impact exercises that protect your joints, such as walking and swimming, or gardening. You can also go to the gym and use their treadmill or cycle. There are some risk factors of osteoporosis that may be uncontrollable, like if you are over the age of 50. Sexual hormone levels could be a high risk also. If you are a woman and you have had your menopause, medication can also be a risk as you may have other conditions apart from osteoporosis, such as IBS, rheumatoid arthritis or celiac disease. Osteoporosis is also called a silent disease, as there are few symptoms, but the symptoms that you should look for are if you are losing any height. For example, you may develop a stoop or bend forward. Osteopenia is another bone density disease, but this one is a predecessor of osteoporosis. This one is a milder disease where it does not weaken the bones as much as osteoporosis. Osteopenia is also an incurable disease. When you get this, you should prevent it from developing into osteoporosis. You can do this by going on a healthy diet. Also, stop smoking and decrease the intake of alcohol. Do exercises to keep the joints moving. For example, they could be weight training to build muscles, stretch bands or tubes, weight machines or weight balls, as well as low-impact exercises. You could also prevent from falling around the house by making sure you have sufficient lighting. You should install rails in the shower, bath and the toilet. Also, remove mats and rugs to ensure they are taped down securely, so the corners do not fold over. The symptom of osteopenia is the same as osteoporosis when you become elderly. This is where your bone mass peaks, and your bones break down faster than you can build new bone. Other risks are if you are a woman and you develop menopause before the age of 45. You could inherit the disease if someone in the family has a low BMD, if you are not having a healthy diet or lacking in calcium or vitamin D, or if you smoke or drink alcohol. You should not consume caffeine, either. Osteoarthritis is a disease that, in time, wears away the cartilage that is between the two bones at the joints, or another name is wear and tear, as it wears away the cartilage surrounding the joint bones, and eventually leaves the bone unprotected, and over time, the bones will rub together. The risk factors of developing osteoarthritis can be caused by falling or injuring yourself. Like myself, I got osteoarthritis when I slipped on ice 40 years ago. The disease started in my hip, where I landed on the curb. And now I am living in pain as the arthritis is traveling around my body. Other risk factors could be overweight or obese. You are at high risk as your weight-bearing joints are putting more pressure and stress on them. Or if you are in a job with repetitive movements, like sport or a factory job like moving boxes all day long. The symptoms are pain when you move the affected joint, but it decreases when you rest. Stiffness can also occur when you have had long rest, like first thing in the morning when you wake up. When applying any pressure to the joint, you will feel tenderness. Also, when you move, you will feel grating, cracking or popping sensations like a bubble wrap coming from the joint. This is where the bones are rubbing together at the joints, and swelling can happen when the soft tissues around the joint are inflamed. Bone spurs can also develop. They are hard lumps that occur around the joints. When you get a severe symptoms of osteoarthritis, you may get more noticeable pain. The affected joint will become noticeable swelling and warm to the touch. If it affects your fingers, your knuckles will become bony, called nodules. There are two types of nodules that can appear. Bouchard's nodes are the bony knuckles in the middle of your fingers. The joint near your nails is called Hepburne's nodes. The nodules are commonly seen in elderly ladies. You will also feel hot around the joints due to inflammation, or in other words, flare-ups. Daily exercise like walking or swimming can prevent this disease from worsening. Lose weight if you are overweight or obese. If you don't, you are putting more pressure and stress on your weight-bearing joints. Your everyday activities may become very painful. It would help if you used devices that reduce the strain and stress on your joints. Devices such as helping with opening jars as you may not have the strength. Finally, unfortunately, children can get arthritis, as well as the elderly. When your child has this terrible disease, called juvenile idiopathic arthritis, it can be very painful for your little ones. Your child may not complain, so you need to look out for feverish or does not want to play, constantly tired or has a limp but has not had an injury. They could also develop painful, swollen or stiff joints. Also red or warm to the touch. The conclusion is that the difference between osteoarthritis and osteoporosis is that osteoarthritis attacks the entire joint, whereas osteoporosis attacks bone density. They both lead to adverse effects like an increased risk of pain. Changes to your lifestyle also reduce your quality of life. And the risk is that they both increase with age. I hope this video has helped, and don't forget to subscribe to my channel and receive notifications when new videos are released.